Insert introducer to desired depth and remove inner stylet. Orient curved needle with tip down into the access cannula. Using your index finger and thumb, bend the needle so that it is in line with the access cannula and advance the curved needle. Be sure the orientation arrow is aligned with desired trajectory. Once curved needle reaches vertebral body, a mallet may be used to advance the needle to the contralateral side. Remove access cannula using a windshield wiper motion. Once the curved needle is inside the access cannula, orient the directional arrow towards the table and remove the curved needle. Using the same technique as the curved needle, insert the flex balloon. Use the offset purple hub as your directional guide. When balloon is in desired position, turn the handle on the inflation device clockwise to inflate the balloon. Once desired inflation is reached, squeeze the handle on the inflation device and pull all the way back before removing the balloon. To remove the balloon, turn the stylet cap counterclockwise until released. Pull back the stylet 3 to 4 inches and remove the balloon. If cement delivery through curved needle is desired, insert curved needle. Remove peak stylet. In cement mixer, add monomer to polymer and shake vigorously for 15 seconds. It is recommended to wait approximately 4 minutes from the time the monomer hits the polymer before injecting. Immediately after mixing, attach mixer to injection device. With cement mixer towards the ceiling, squeeze injection device handle and pull back plunger slowly. With handle still squeezed, push air out of the injector and pull remaining cement from the mixer. Remove mixer, attach delivery tube, and prime the tube. Attach injection device to curved needle. Inject cement until the plunger is flush with the 10 cubic centimeters line. This should be sufficient to prime the curved needle. Allow 20 seconds for initial prime and verify with fluoro. Inject cement until desired fill is achieved. Turn injector handle counterclockwise 2 to 3 turns to relieve pressure. Remove injector from curved needle. Remove curved needle and reintroduce inner stylet to the access cannula. Using a twisting motion, remove the access needle.